We are a group of dedicated workers who would like to create awareness about the current pandemic so that our nation can fight with the utmost intensity to put an end to corona pandemic. In human, several coronavirus are known to cause respiratory infection ranging from common cold to more severe diseases such as Middle East respiratory syndrome and severe acute respiratory syndrome. So, how one can know that he or she is suffering from coronavirus? We are here with a few symptoms: fever, dry cough, breathlessness, tiredness. Some patients may also experience aches and pain, nasal congestion, sore throat, running nose, and diarrhea. On an average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days also. So now let us see how does it spread.
People can catch COVID-19 from others who have the virus. The disease can spread from person to person when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, then touching their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. This is why it is important to stay more than 1 meter away from a person who is sick, who is at risk of developing severe illness. While we are still learning about how COVID-19 affects such people, older people and people with pre-existing medical conditions such as hypertension, heart diseases, lung diseases, cancer, or diabetes appear to develop severe illness more than others.
If you develop some of the symptoms of COVID-19, then take the following steps. Step 1. Do not visit the general practitioner, hospital, and your pharmacy. Step 2. Contact the National Health Service helpline. Step 3. Self-quarantine. Step 4. Your details might be passed on to the local health protection teams. Step 5. You may be then tested for the virus. Step 6. Follow the advice of the respective doctor and nurses.
Following are some of the precautionary measures that one should take to prevent the spread of coronavirus in a community.
Maintain social distancing. At least 1 meter distance should be maintained between individuals in a community. Frequent hand washing. Regularly and thoroughly clean your hand with alcohol-based hand wash or wash them with soap and water.
Scientific steps of the hand washing. First step, start by washing hand with soap and water. Rub hand palm to palm. Second step, rub back of the hands. Third step, rub palm to palm with finger interlaced with the palm of the other hand. Fourth step, rub with back of fingers to the opposing palm. Step 5, sweep hand from finger to thumb. Step 6, rub tip of finger in opposite palm in circular motion. Step 7, rub each wrist with opposite palm. And finally, rinse the hand with water.
One should cover their nose and mouth while sneezing and coughing using a handkerchief, and if the handkerchief is not available, one should use his or her elbow as the elbow comes in least contact with the face. If you are using tissue, immediately dispose it in a closed bin. Avoid touching nose, eyes and mouth. Cover your nose and mouth, preferably with a mask in any social surrounding. And if you don't have a mask, a piece of cloth is used. As Government of India announced lockdown and the guidelines should be followed strictly as it is for our own safety, and leaving home should be avoided.
Remember, a mask should be used by all healthcare workers, caretakers and individuals with respiratory symptoms such as fever and cough. Before taking the mask, clean your hands with alcohol-based hand wash or soap and water. Take the mask and inspect it for tears and holes. Orient which side of the mask is the top side. Ensure the proper side of the mask faces outwards. Place the mask on your face. Pinch the metal strip of the mask so it molds into the shape of your nose. Pull down the mask bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loop from your face to avoid touching a potentially contaminated surface of the mask. Discard the mask in a closed bin immediately after use. Perform hand hygiene after discarding the mask. Use alcohol-based hand wash, and if the hands are visibly soiled, wash your hands with soap or water.
We want to conclude by saying that staying apart is the best way to stay united. We all will win together. स्वास्थ्य है सबसे ज़्यादा महत्वपूर्ण, इसके बिना है जीवन अपूर्ण. मिलेगा आप सबका साथ तो जीत जाएगा इंडिया. जय हिंद.